I'd like to introduce our next speaker, Dr. William Henrich, President of the UT Health San Antonio. In the interest of time, we're going to invite you to read the bios of speakers rather than spending time reading them to you. They're available at TAMEST.org. As you're listening to Dr. Henrich, please think about questions you might have. There are microphones scattered. Throughout the room. There will be microphones scattered throughout the rooms. It's what you get when you read a script, right? So we'll have those in place by the time that Dr. Henrich has finished his comments, and we would invite you to approach those and ask him some challenging questions. Dr. Henrich, we're so delighted to have you here and looking forward to your comments.
Well, good morning, everybody. Wonderful to be here. And thank you, Nancy and Amelie and members of the committee for including me in the program. You know, when I was invited to make remarks to kick off this meeting and speak about academic medical centers and improving public health, I, of course, was thrilled and honored and pleased to accept, at least for a few minutes. After a little bit more reflection, I realized that accepting the assignment may have been a category error for me. After all, full disclosure, I'm not a trained expert in matters of public health. Plenty of people in the room are. I'm not one of you. My perspective on public health is built on years of on-the-job training. I've been a chairman of medicine in 2 large medical schools. I've been a dean of a school of medicine, and now I'm a president of a health science center. But putting that disclaimer aside for just a moment, I've thought there might be 2 reasons why it might be argued I was a good choice for this talk. First and foremost, I'm a physician. I'm committed to improving health and to saving lives. From my viewpoint, the fundamental principle that underlies all the implicit aims of good public health is that every life matters. Every life is precious. And that good public health is aimed at harmonizing policy and process to yield the best health outcomes. Elements that stand in the way of progress to improving and saving lives, as Nancy just mentioned, these social determinants of disease like access to care and poverty, education, politics, all must be viewed for what they really are, at least to me. They're barriers to the best care, barriers to improving the human condition. So at the core of what I hold to be true is that underlying the best public health efforts is the tacit understanding that all human life is precious. In public health matters, everyone counts. So before delineating my second possible credential for speaking about public health, let me list several tangible steps we've taken here in San Antonio to lift the public health. And keeping in mind that we've elected here to tackle the larger scale problems we've been faced with in our city, things that harm our citizens directly. And to place this in context, I want you to understand that our academic medical center in San Antonio, UT Health San Antonio, is the only academic medical center in a 38-county region which is the size of Pennsylvania and has the population of Minnesota. Could I have the first slide? There's a graph that shows this graphically. Now here's the other thing, friends. Healthcare market share here has been historically dominated by for-profit national companies. So we at UT Health, in close partnership with the Bexar County Hospital District, with Metro Health and other partners, we've had a large task in improving public health here in an area of the state characterized by much lower incomes than the northern part of the state, with limited access to care. So several of the notable contemporary public health advances we've tackled include the following. The next slide, please. We've administered COVID vaccinations to hundreds of thousands of citizens. We converted our School of Nursing into a vaccination hub and then deployed a vaccination van. Next slide, please, to reach those who couldn't travel to us. Next slide, please. We've established an Alzheimer's Disease Research Center funded by the National Institutes of Aging here. It addresses neurodegenerative diseases which are 30% more common in Hispanics. This is the only National Institute of Aging ADRC in Texas. 28 million people in Texas, the only one in Texas. And it has an outreach as far south of us, down to Laredo. We focused our NCI Cancer Center on opening access and focused research on those cancers, particularly hepatocellular cancer and gynecologic malignancies, which afflict our population of patients. We lead several of the state's efforts in the prevention and treatment of opioid addiction and overdose through this program called Be Well Texas. You may not realize, but 10% of Texans have an addiction problem. That's almost 3 million Texans have an addiction problem. This Be Well Texas program, in cooperation with the health department in Texas, is trying to improve that. And then there's the Casa Mia program for babies of addicted mothers that we've started here and has gotten traction and is now spread across the state. That's led by Lisa Cleveland. We've expanded our outreach in diabetes and metabolic disease through partnerships with the county health system. We are the proud home of Salud America, one of the nation's most successful Latino-focused programs that creates culturally relevant and research-based stories to help people drive change in policy and systems and environments for Latino children and for their families. And it's ably led by Nancy's colleague, Dr. Amelie Ramirez, former past president of TAMEST. We have one of the state's largest programs in PTSD called Strong Star, chaired by Alan Peterson, with close alliances to military medicine. This program addresses, in partnership with many agencies, the mental health needs of our region. And we've also, if I could have the next slide, please, we've also supervised the construction of the new San Antonio State Hospital. These are being built in Austin, Dallas, and San Antonio. And in East Texas, these new facilities are so badly needed. Anyone who's visited a state hospital in Texas 5 years ago could make a compelling argument that this was a blight on our state, that we had to improve these facilities. These were out of another century. They were so primitive, so crude, and the care could not be delivered in a modern place without these new facilities. This is the current construction picture of what they look like, what the one here in San Antonio looks like. And finally, next slide, please. We've embarked on a plan to create a new school of public health here called the University of Texas School of Public Health San Antonio, with the firm support, I'm happy to say, of the Board of Regents of the University of Texas, and uniquely in partnership with my good friend and partner, Taylor Ames, in the audience today, the president of UTSA. This is unique. A health science center and a large undergraduate campus joining together to try and create an action-oriented, research-oriented new school of public health for San Antonio. We've received enthusiastic support from the Bexar County Commissioners, from the Mayor's Office, from the City Council, and having it here will coordinate and prioritize which domains of public health we assess first and in what order we assess them, and research will be an important feature in this school. Now let me close with two final thoughts. You know, I said at the outset I'm not a public health expert, I don't have the academic bona fides in this subject, but then I said there are two parts of my background that inform a perspective on the public health. And the first of these, I told you, is that I'm a physician, and that all life is sacred to me. The second component of my background is that, those of you who don't know this, I'm a nephrologist. And if you don't know what that is, that's special training in internal medicine and kidney disease. Nephrology is a discipline inexorably bound to facts, to numbers. Nephrologists are required to build logical and plausible clinical stories out of what are often complicated and often conflicting data sets. And when the data sets are in conflict, when the data seem to make no sense, which is often the case in clinical medicine, you can't retreat to claim lab error. It's a cop-out, can't do that. And you can't make up another story. You're bound to the facts. You're immutably bound to the facts. The facts emerge as noble numbers, and when interpreted correctly, they often lead to new insights to explain a patient's circumstances. And if you're successful, they lead to the correct treatment plan, the correct fluids to give somebody, and how much to give them, at what rate, what the content is. All of this is bound by an analysis of fact and number. And of course, being bound to facts is a core feature of being a physician. Which leads me to the final point I'd like to make this morning in these brief remarks. To me, the single biggest barrier to improving public health, this is just to me, to Bill, improving public health in Texas and the United States, is the proliferation and unprecedented prevalence of an anti-fact, anti-science narrative in the United States and in Texas. Untruthful narratives have many origins. Some are born out of a craven political ideology. Others have basic roots in hate, in racism, in bigotry. Other lies emanate from fear because, as we all know who have backgrounds in science, the facts can lead you to uncharted territory, a place you've never been. And in so doing, following the facts can contradict dogma. They can make you uncomfortable. So this can be a little uneasy for a lot of people. To arrive in a world untethered to reality means you must fundamentally deny truth. You have to deny reality. This is apparent in the ongoing epidemic of the uniquely American plague of mass gun violence, now the leading cause of death in American children. And here in San Antonio, if I could have the next slide, we have been deeply affected by this calamity. This slide shows on the left Dr. Lillian Lau, who's the director of the pediatric trauma services at our institutions. And on the right is Dr. Ronnie Stewart. He's the chair of the Department of Surgery at UT Health San Antonio and head of trauma surgery at University Health System. I hope you can see in their faces the stress, the horror of what they've been through. They cared for the Sutherland Springs victims years ago and had the task of caring for the children and adults murdered in Uvalde just weeks ago. I can't express in just a few words the toll this has taken on us. They brought the bodies of these precious children and adults to San Antonio for their autopsies, and it deeply affected me to know that they were here, to know that they that they had their last stop here. These voices of denial and anti-science are loud and persistent, and they can build fearful narratives by exploiting gaps in knowledge, assigning blame to others. In the case of the anti-vaccine and gun violence movements, they often create an array of false narratives to reduce clarity and to obfuscate the truth. Of course, the major irony here, at least for me, the major irony, I hope to each of you, is the fact that science has never advanced more rapidly than it's advancing today. It's never had more of a direct positive effect on public health than it has today. For example, just 2 days after the genomic sequence of the COVID virus was published, just 2 days, the design of the Moderna mRNA vaccine was completed. 2 days. Maybe there's some consolation in knowing that the anti-fact, anti-science movement has been with us a while. Maybe you'll find some solace in that. We've seen, or we should have seen, this movie before. And the next slide. This next slide shows the memorial that my wife Mary and I visited in Uvalde after the shootings there. This is a town and a region that will have a difficult time for decades, generations to come, getting over this. Next slide. An apt example from the past of anti-science, anti-truth narratives is perhaps best provided by the example of Galileo Galilei, the Italian mathematician and astronomer who, through careful observation, contradicted the Aristotelian view that celestial bodies revolved around the earth. Everything revolved around the earth. Then Galileo had the temerity to support a theory by Copernicus, a scientific argument that the universe we are in was a sun-centered universe, and this resulted in Galileo being summoned to Rome by Pope Paul V. Galileo went before the Holy Inquisition in 1633. He was convicted of, and I quote, vehement suspicion of heresy, end quote. That's a charge for you. He was threatened with torture. He spent the last 9 years of his life under house confinement. But 102 years later, after his conviction, during the Age of Enlightenment and defended by prominent writers like Voltaire, Galileo was exonerated. The Catholic Church reinstated Galileo's banned books, and Popes Pius XII and John Paul II made official statements of regret for the Church's treatment of him. In today's reality, the internet echo chambers of distortions and lies make course correction even more difficult than it was in Galileo's time. But we have to try. We have to try. So if I'm right and it's true that science and fact denial are the largest barriers to progress in public health, then we badly need some new tools, don't we? Some new tools to combat the adversaries we face. We need a new message that you don't have to fear the truth. You don't have to fear the facts. My friends, Galileo and Copernicus were correct that the earth revolves around the sun, and the Catholic Church has done just fine since then. How many of you have had experiments that you've worked on for a year or two that didn't come out the way you thought they were going to come out? but they opened up new doors to discovery, new things you hadn't even thought about as possibilities. And that opened up new lines of research, endeavor, inquiry. So we need new educational materials. We need new marketing materials. We need new strategies. We need new recruits. Badly need new recruits to public health. There's a rich literature on how to communicate with fact deniers, and we should, all of us, endeavor to learn this literature and take it up. So Dr. Dickey and Dr. Daniel and Dr. Ramirez, I hope there'll be in TAMEST, given the prestige of this organization, an appetite, a willingness to engage directly with fact deniers. If I were to pick one issue that I would say as a physician engaged in this topic that I could do that would help Texas, I'd select the expansion of Medicaid in Texas. It's a program which would allow a minimum for childhood checkups. Childhood checkups. 1 million uninsured Texas children. No access to childhood checkups, to asthma inhalers, to simple medicines, simple things that are available to the rest of the population. What kind of a thing is that? Other preventive medicine services would also be available. So listen, this road we're on is steep, it's unrelenting, it's likely unending, but the stakes and the effort are too high for us to get mission fatigue and allow that to defeat us. Too much is at stake. I think I'll show this slide. I wasn't going to show it, but I think I will. If I could have the next slide. I took the grandkids on a trip to Colorado, and during that trip, I ruined the trip by thinking about this talk, about how unqualified I was to give this talk. I spent the whole time worrying about it, and I thought a lot about the future in seeing them, seeing what they're doing in their lives. These young people are dependent on people in this room, people like TAMEST people. And I think that addressing public health concerns is a core mission, therefore, of academic medical centers like ours. It's really a mission for each of us, even for people like me without formal training, TAMEST for everybody. We must fully commit to this cause to bring the amazing scientific discoveries of our age to full effect. If we don't do that, if we don't win this debate, if we don't prevail, then the new scientific discoveries we can bring that will lift up the whole population won't have full effect because they'll be defeated by people standing on the sidelines, making up false narratives for one motive, reason, or another, and we'll lose. And that's a shame. That shouldn't be allowed to happen. So that for them to be in full effect, all of us have to try. And if we are successful, better health outcomes will follow. Good health is an invaluable commodity. And a future that's bright with promise depends on the success of all of our efforts. Thank you very much for having me here today. Nancy, thank you for inviting me. I was glad to be here. Thank you, David.
So we have about 10 minutes for questions and answers. They did bring us microphones, and I would invite you to come up and see if you can stump Dr. Henrich. Let me start if I can. You talked very effectively, I think, about the fact war out there. And I'm going to speak from the medical perspective. It's one you and I both know, but I suspect that engineering and all of you from the variety of science could address it from yours as well. And that is, Should we be adding something to our curriculum to help our graduates understand that we've got an obligation to individual patients, we have obligations to our community, but we have obligations to our science, and maybe we need to be teaching them how to better address the facts. As you were talking about 2 days after the sequencing came out, we already had the steps for the Moderna vaccine. It dawned on me that part of the fact pushback has been how fast it happened. It can't be good science. So what is our role in educating the next generation and helping make them soldiers in the fight for facts?
Well, I agree with the sentiment expressed in your question, which is that these new tools I vaguely alluded to include a curricular change that allows scientists to communicate more effectively and to get ahead of the anticipated blowback, pushback that will inevitably occur today. No matter what you do, I don't care what cure you have in your hand, what you publish in Nature or Science or the New England Journal of Medicine, there will be, in today's world, on the internet, within minutes, there will be a backlash. There will be people who will try to deconstruct what has been published. So I think it is important for us, I think it's important for young scientists and scientists of any age to anticipate this reality and to be ready for the arguments, the counter-arguments that will now be leveled against you. I think that should be embedded in curricula, as you suggest, but I also think it's an important feature of our public policy. And I think that people need to get ahead of it. I think university presidents and deans, division directors, department chairs, everybody at every level, institute directors, whether they're freestanding or parts of universities, everyone has to be enlisted in this effort and can't be naive about what you're going to face when you publish these things. So it's a general answer, Nancy, but I think the times demand that we up our game, that we tune it up.
Right. Mary Pat?
Oh, he was here first.
I'm sorry. Yes, go ahead. I was talking.
Go ahead.
Hey, Bill, thank you for a really, really enlightening talk. So I'm thinking about what do you really have as action items inside the university task forces, education forces within the, where you really go after something? Is it integral to all of the institutes? Is it integral to all of the different areas of work to educate the public? And then secondarily and related is, as a president of a UT university within a state that doesn't always handle the truth very well, how do you navigate that? She said put him on the spot, Nancy, come on.
I wish I could say, thank you for your question. You're totally dishonest. Look,
Yeah, right.
well, look, it's a fair question because everything exists. Nothing exists in a vacuum.
Right.
And the way I want it to turn out or the way you want it to turn out isn't the way that it's likely to turn out if we just wish that to be true. I mean, there are political landmines here, and there are legitimate cases to be made in some instances that have to be taken into consideration about the truth. A small digression, and I'll try to return. One of the weapons that's been used against science, especially in the vaccine narrative, is that there are gaps in knowledge. Just what you said, the vaccine came into reality in record time. Let's face it, I mean, in lightning time. What normally would have taken 6 to 8 years of development was ready in days, and the vaccine was then mass produced and so forth. And that was an opening for those who have an ulterior agenda to criticize it and point out that it must not be safe. Now, happily, the data we have on the COVID vaccines is deep now and very reassuring and shows how effective it is. Look, it's all hands on deck for what the answer to your question is. And I don't know any other word other than persistence and these new tools. There is a deep literature, you could look into it, about how to talk to people who don't tell the truth, how to talk to people who are polarized against the truth, how to talk to people about each of these things, because the motive for many of these folks is what I alluded to a minute ago, which is fear. Fear of the unknown, fear of something new, fear that we're going to lose control of something. And I think each of us needs to get skilled about doing that. I think universities can do a good job at educating people. And I think if we do that, we've got a chance. I think if we don't get tired and don't become so fatigued that we give it up, I think we've got a chance to do it. And but it's not easy. You saw those signs that people carry.
Right, exactly. But the thing is that everybody in this room has a responsibility. It isn't just the responsibility
It is.
of universities. We're all experts in our field or we wouldn't be here, right? So, but does everybody reach out? Does everybody an activist? Is everybody involved? Probably not.
No.
Because it's not all about you. It's not all about you and your grants. It's not all about any of that. It's about the future for our grandkids. It's about the future of our democracy. And so, not to be all dramatic about it, but it's really important that we look at this as our responsibility, all of us. And the fact that it's okay to blow children into hunks of meat and think that's okay is ridiculously horrible. And it's just untenable. And so we need to be on top of it, all of us who are involved in these fields. So thank you for your remarks, and I know I put you on the spot.
I forgive you.
We have time for one more question. Yes.
So I'm Leon Thompson from the University of Houston, and so I'd like to thank you for your insights and for your passion. Of course, you're speaking today to an audience of believers in your message. I hope you will give this same talk to other audiences which are less committed to these ideas. When you do that, let me relate a story from Galileo, which makes your point very nicely. While he was on trial, you know, of course, that his proof for the heliocentricity was simply telescopic observations of the moons of Jupiter. And so while he was on trial, the priest who was interrogating him was accusing him of heresy. So Galileo said, well, just look through the telescope. You will see the moons of Jupiter revolving around Jupiter, not around the Earth. The priest said, I refuse to witness the obscene spectacle of nature contradicting reason. So you see, the priest was making a theoretical argument, and Galileo was saying, just look at the facts. Mm-hmm. It makes your point very nicely.
Thank you for your comment. Thanks, Nancy.
Thank you, Dr.
Okay.